So now let's look at some of the movements that we have occurring at the lower limb. So here we can see movements that are occurring at the hip joint. We have flexion and we have extension. We can see the hip joint being flexed in this direction and then being extended as it's returned to the standing position, and then hyperextended, backwards in this direction. We can see we have abduction and adduction possible. With abduction, the leg is moved away from the midline, and with adduction we can see it's brought towards the midline, and is actually possible of going across the midline and across the other standing leg. Here we can see we have lateral and medial rotation occurring where the leg is turned inwards towards the body, lateral rotation, and it's also turned outwards away from the body, medial rotation. We can see at the knee joint, we can continue, have flexion and extension where we see the knee is fully extended. Here we can see it goes straight on from the thigh, and we can see it's flexed when the heel is brought towards the posterior surface of the thigh. Again, we can see we have medial and lateral rotation of the knee where the foot is turned either inwards or it's turned outwards, medial and lateral rotation. If we look at the ankle joint, we can see we have dorsiflexion, where your heel is on the floor and your toes are lifted upwards. And we have plantarflexion, where your heel is lifted upwards and your forefoot, your toes, are depressed onto the floor. We can see we have inversion and eversion, this again occurring at the ankle joint. With inversion, the big toe, your number 1 toe, is lifted up and your little toe, digit 5, is remaining on the floor. And conversely, with eversion, you have your great toe, number 1, remaining on the floor, whilst your little toe, digit number 5, is lifted up. Inversion and eversion. If we then look at the toes, you'll see because we have the interosseous muscles, which we'll later on describe, at the toes is possible to abduct and adduct these individual digits. Along with this movement, there's also flexion and extension, so you can dorsiflex and you can plantarflex your digits. So in this lecture, we've looked at the surface anatomy of the lower limb, the inferior appendicular skeleton, to look at the gluteal, thigh, leg and foot regions. And then we've looked at the osteology of the lower limb. We've looked at the gluteal region where we had the ischium, the pubis and the ilium of the hip bone. We looked at the thigh with the femur, the leg and the tibia, fibula, and then the foot, looking at the tarsals, metatarsals and phalanges, and looking at some bony landmarks on these bones. And then to finish, we briefly looked at the movement of the lower limb.
You just completed your first video of the world's best medical exam preparation. Lecturio brings the knowledge of worldwide leading medical experts and teaching award winners to your PC, tablet, or smartphone. Prepare yourself and check your progress with thousands of quiz questions customized to USMLE standards. And the very best, you can get in touch with our medical experts personally. Visit Lecturio.com now and continue with the most inspiring medical education around the globe, anytime, anywhere.